And we want to get some more information on those masks, why they're so crucial for healthcare workers. For that, we're joined now by CBC medical correspondent and family physician, Dr. Peter Lynn. He's in Toronto. Hey, Dr. Lynn, good to see you again.
Hi, Vashi.
Help us understand the difference between N95 masks and, for example, surgical masks. These are the masks, the N95s, that the president is trying to block Canada from getting right now.
Right. So the N95 masks are fitted so that they're sealed around, and they actually do a special test where they put a bag over your head once you've got it fitted, and they put chemicals in there for you to smell. So if you can't smell the chemicals, then the mask is sealed and it's proper. So that will stop 95% of the viral particles. Very important for people that are right close to patients, for example, that have COVID-19, because there's a lot of viral particles that are sitting there. For the normal surgical masks that you always see people wearing, those ones are leaky. So those are helpful for in other situations, but the N95 is crucial for people that are looking after patients that have COVID-19. And right now we have about 500 plus patients in hospital situations that will require that kind of level of protection.
What about the supply of it? It's hard for us to ascertain exactly, because it depends on the province, how many of those masks really healthcare workers need. What do you hear from your colleagues about the potential for a shortage?
There is rationing already, and that's already happened before any of this situation happened with the Trump administration, because the hospitals were realizing that we can't afford to have all the masks being tossed away. Because most of the time in each situation, when you go from one patient to another patient, you have to get rid of everything. So that's why in the beginning they said we need to keep these masks so that you get 2 per shifts, or they were limiting it. Only because they wanted to make sure that there was enough supply floating around. But learning from Italy, what they keep telling everybody is locate all the COVID-19 patients in one location. What they did was they actually pushed everybody into one hospital eventually. Like at first it was all over the place. So you might have a patient here, which now means that anybody that goes into that room has to gown and then disgown and get rid of everything. Whereas if you keep everybody together, then basically the doctors and the nurses and all the healthcare personnel can wear the same gown, the same mask, and look after many people at the same time. So let's say there's 10 people in one area, they could look after all 10 people. They don't have to keep changing things. And that way we could decrease the number of personal protective equipment that we go through. Whereas if you have one patient here, that becomes difficult. So the Italian experience is clump everybody together so that way you don't have to keep changing your personal equipment.
Okay, appreciate your expertise as always, Dr. Lynn. Thanks so much for joining us.
Thanks, Vassy.